Good. So I'm going to quickly run over the functions of the Saros chair. So it's a manual tilt and space chair. That is, from an upright position, you can tilt the chair to 30 degrees, which obviously will help with transferring patients in and out, especially if they're hoisted. It will also help distribute pressure better, and also make the patient feel safer. So, as tilt and space, we also have leg rest elevation. So, especially when the chair's tilted, the patient might need to have their legs elevated. So, with the tilt and the leg rest elevated, the legs will be level or parallel with the ground. Press number 2. So that's the main function of the chair. There's quite a lot of adjustments to this chair and accessories which we'll run through. The idea is we've got a product in stock which will work and can be adjusted for majority users. The assessment form will help you identify if your patient isn't going to fit this chair and if they need something outside of it. So that might be someone that's a bariatric patient, so it might be their weight or even just their overall size. It could be a child. So thankfully the standard Saros chair here will accommodate someone from about 16 years old. But anyone younger, we have a petite option of the Saros, and then we also have Good. So that's the function. So with seating, as we would all know, the most important thing is the size of the chair. If the size is not correct for the user, we could be starting to create pressure issues. We can affect their posture. So overall, the size is the most critical part to any seating assessment. So the assessment form runs over what sizes we can achieve, but I'm just going to show you now what is achievable and how we do it. So the seat width on the Saros, the widest it will go is 20 inches, and you can narrow the seat width down to 16 inches. So the way we do this, and this adjustment, we do have online videos which I'll send you. There's a pin underneath the chair which allows us to move the armrest in and out. So we can achieve a 16, 18 or 20 inch seat width. So I'll just show you, to zoom in this side. So now you can see that, but there's a pull pin here, which when you put it out, it allows the armrest to move in and out. So we can put it to make the seat width wider or narrower. The useful thing with this is sometimes you might have a patient in the chair, or you might have prescribed this chair, and when the carer's putting slings on, or if you find it's a bit tight, you can actually adjust it once it's already in situ. So one idea is with the YouTube videos of how to do that, you can send that to care teams or carers or family to make small adjustments if needed. So at the moment, this is on 16 inch seat width, and we did have it up to a 20 inch. One thing with the design of this chair, the arms are very soft. So although the external width is 20 inches on its maximum, if someone's touching the sides, it's not going to be creating very much pressure anyway onto the patient. Good. So the second adjustment, which is crucial for size, is the seat depth itself. So on the back of the chair, we have a bracket, and that allows us to adjust the seat depth. So with the brakes on, we can adjust the backrest from a 17 inch seat depth up to a 23 inch seat depth. So that will accommodate, in real terms, someone from about 5 foot up to about 6'3". So that is on its narrowest, and then we can simply make the backrest slide back, and it gives us a longer seat depth. So I'll just quickly show you that bracket. But underneath the backrest, there's a trigger. And when you pull the trigger, it allows the backrest to move backwards and forwards. Obviously, when we send out the how-to videos, you will see how that's done. So I've just had a couple of questions. For those of you that joined just now, if you have any questions, there's a chat button at the bottom of your screen, and you can type a question in. So I've just been asked, will it work or allow for a Saros steady transfer aid? It will do. So predominantly this chair is designed for patients that are fully hoisted. Most, or if not every, stand aid will work with the chair. If someone's done a standing transfer from the floor, you might struggle to get someone to sit back far enough in the chair. So quite often when we're doing an assessment, we always look at, to identify the patient's going to be suited to this chair, we look at how they transfer. If they are fully hoisted or using a stand aid or some kind of transfer aid, this is likely to work. If they're doing a standing transfer, you'd be looking at more of a rise recliner type option, a chair. Good, so we looked at the seat width and the seat depth. The seat height is fixed at 22 inches. The way we support the patient, however, is with a foot plate. So the foot plate, there's a bracket underneath the chair. And we can slide that foot plate anywhere between 16 and 21 inches. So it means when the patient's in the chair, their feet will be supported, and especially if we're looking at, well, I guess a lot of the patients are in here for a reasonable amount of time, they will definitely need their feet supported. We do have a couple of options of foot plates. We do have an angle adjustable foot plate as well. So it's just something you'll need to look at during your assessment. The other adjustment we have in the chair, which is probably a little bit difficult for me to show you, but I'll give it a go, is we can actually ramp the seat. So the actual seat cushion at the moment, it's level, it's flat to the floor, but we can ramp it 5, 10 or 15 degrees. Does that make sense? So what that means is if a patient needs a lot of support, but perhaps they've been in the chair most of the day and they're having to be sat upright for eating to help with digestion. If they need postural support and they're upright, it's likely that they'll slide in the chair. So the reason we have the seat ramp means you can bring the chair upright. When the seat is ramped, it will still keep their pelvis back and reduce the chance of them sliding. So hopefully that makes sense. On the how-to videos, it is quite clear because the camera can get up quite close. Again, that is an adjustment under here, and it just allows the seat to drop up to 15 degrees an angle. So just created more room here. So if there's any questions, give us a shout. Someone has asked, is it standard stock on NRS? Which it is. So what we will find is this will suit majority of patients' needs. And obviously getting it from core stock is a lot more cost effective, it's a lot quicker. And with our assessment tools, you shouldn't need to spend so much time trying to do the assessment. That's the whole reason for us putting or collating all this information together. So we've spoken about the size, so seat width, seat depth adjustment, foot plate height, and seat angle. So there's a couple of other things we tend to look at with seating next. So one would be postural support, and the other would be pressure management. So we'll just touch on postural support. The standard backrest for this chair is called a butterfly backrest, and it's been designed in a way that it's very soft. So if you have a patient with any spinal curvature, so it might be they're kyphosed, and sometimes their spine might be quite prominent, so risk of pressure damage. This backrest will mould, so it will support and offer pressure relief for anyone that's got scoliosis, kyphosis, or any type of spinal curvature. We have actually had a lot of success with people in moulded wheelchair seating, where their spine is very deformed, and it's a struggle to seat them correctly. And as a comfort chair, so kind of a bit of time out from the moulded wheelchair seating, this backrest works very well at accommodating them. It will allow them to sink back into the chair. The other design with the backrest is it has these quite large lateral orthotic supports. Just bring it a bit closer. So it's actually quite deep. So obviously the use for it is to give some lateral support, so we're going to try and achieve a good midline position. A couple of nice things about these is, one, they're soft, so a lot of lateral supports are quite firm, and if it's meant to be a comfort chair and you're sitting in it for a long period of time, quite often feedback we've had on other chairs is when they're too hard, it doesn't actually make it that comfortable. So that's one reason it's soft. Second reason, if anyone has involuntary movement, so they might have Huntington's disease or Parkinson's, if they're moving around or have these involuntary movements, there's no way they can hurt themselves on the chair. So there's no metal bracket or anything for them to hurt their arm or their side on, which is why this is soft. That is also another reason the arms are soft. Again, for anyone with involuntary movement, we have had a lot of success with patients with Huntington's and this chair, just for that reason. So a lot of people ask, well, if someone needs a lot of targeted support, perhaps they've had a then stroke, or they've really low muscle tone, how can we increase the lateral support in this chair? So this will offer a degree, but for some people, people are leaning very heavily, this might not be enough. So there is an accessory, a foam wedge. So it looks quite basic, and that's because it is. However, what's quite nice and easy about it is you can put it behind the backrest at any point you want to. So this will sit behind the backrest. And what we'll find now is, because of the curved wedge, when someone leans heavily, this support is a lot more rigid now. It won't just give way. So with these wedges, we can put them behind the backrest at the top or at the lower part of the backrest. We can also put them behind the headrest. So I'll just show you that. So it might be when you hoist someone into the chair, their head is quite far away from the backrest, especially if they have kyphosis. So with the wedge, we can pop that down behind the backrest. And then what we find is this section here is now a lot more prominent, so it will offer a lot more support for the patient. Okay, so it's quite a simple option. The other good thing with the thoracic wedge is they're once they're put in place, you're not relying on carers or any of the care team to actually adjust or change the lateral support position. Another good reason for these thoracic supports is if you're hoisting someone into the chair, they can be hoisted in without anything being in the way. So if you have your traditional bracket with a lateral support on, it's often very difficult to hoist someone and manoeuvre them between them to sit them right. Whereas with this, they will move out of the way to get the patient in, and then obviously the wedge can support the patient better. So I'm just having a look, we've got a couple of questions. You probably can all see that anyway. So one is about guidance and how long individuals can remain in the chair. So really that's down to, you'd need the advice of a tissue viability nurse really. It would depend on the sore. All I could say from my experience is if someone doesn't have a pressure sore, if they're using the chair correctly, and that is not just leaving the chair upright, but sitting the patient in it, making sure it's tilted and adjusting the tilt angle, say every hour or 30 to 40 minutes. If you're adjusting it every 30 to 40 minutes, that will help blood circulation and it will also reduce the pressure. If someone has a high or has a pressure sore or is at high risk, we do have a couple of seat options. So the seat cushion itself is removable. So this is a visco cushion. So it will offer a medium risk pressure grade. However, so the standard seat cushion I'd always recommend for anyone that doesn't have pressure sores or isn't at high risk. If anyone has either of those, we can provide a different seat cushion which has a cutout for an air cushion, an alternating air cushion to go into it. So in those situations, the way it works is you take the alternating air cushion out of core stock and we'd provide you with a seat cushion which has like an envelope in it, and that'll allow you to slot the air cushion into it. So hopefully that answers your question. Obviously, as we know, pressure sores aren't necessarily just because of a product. It can be down to someone's medication, the way the position of the chair is. There's lots of factors. So ideally, a nurse or tissue viability nurse would be the best one to get the advice from. The other comment was about the thoracic supports, the wedges. They're not a core stock items, they would be a special. However, as with the RAS chairs, we would always recommend you try the standard chair first, even if you feel the patient might need additional lateral support. I'd always say try the standard chair first, make the adjustments and then see what happens. Hopefully that's giving you enough detail. So I'll show a little look at the questions here. So just two things. So one is there are recycled chairs in stock. So if you do need anything special, get in touch with the clinical team at NRS and they'll let you know. Also, as regards the air cushion, they do have recycled cushions with cutouts already in stock. So I'd always say your first port of call for advice or any guidance around accessories, go to NRS first, Denise or Kaylee, and they'll let you know what they got. Just been asked about the material. So the chair itself is covered in what they call Dartex, which is a four-way stretch material. And what that allows to happen is when a patient sits in the chair, it has enough give to kind of support them correctly. It is like it's similar to an air mattress, it is waterproof. So if any liquid or anything is spilt on the chair, any fluids, you can dry that and wipe it off straight away. So clean air wipes, alcohol wipes, there is some instructions as well on the assessment form, so we can get that sent over to you. The chair does not come as standard with the cutout for the air cushion. That is an accessory. So when we look at the proportion of chairs we provide and how many need an alternating air cushion, it's actually a very slim majority of people that need that. So yeah, it's not a standard item. Good. So just a couple of other things. The standard chair is a manual, so that is there's a lever to tilt the chair. And to elevate the leg rest, there's a catch on the side here. It's not core stock, but there is an item, kind of, or an accessory, if you need an electric option, which generally, it's not that common actually, but if the patient lives by themselves and they need to adjust their own position, they might need a powered option. There probably is a few other reasons, but as I say, it's not that common. We do have a special price for Ken if you want to go for an electric option. So everything else is the same, but it's a powered version. I also have Silas on the call, Silas Woodcock. I didn't know whether he had any other points to add. Okay, he's not. He had to phone a customer. Okay, so is there any other questions? We should have one come in asking, can the core stock chair be converted to electric? Denise, would you like me to answer this, or would you like to? No. Okay. So that's a good answer. It can't. It's actually more cost effective to leave the manual chairs as they are in terms of recycling, and to purchase an electric one, which is a special rate anyway for Kent. But if we keep it that way, so keep the chairs either always electric or always manual, it makes it a lot easier for storing the chair, recycling it, things like that. So hopefully that answers it. Good. So another question, are we doing assessment visits at the moment? So with a lot of the patients we see being very vulnerable, we don't. It's not something we'd do. We wouldn't want to put anyone at risk of catching the virus. I think the whole point, and you'll see this as we move on, but with the assessment tool and the remote assessment tool, you'll be using our resources and the resources of the care team to help you ascertain if the core stock product's going to work. So we can run through it with you online. We have been doing some online assessments. So like this meeting, we'll have yourself calling in and then the family or the patient calling in. We can show them the product. We can look at, and through their video, we can look at the environment, have this space, look at their posture, things like that. I think what we find is because most of these products are so adjustable, and with how-to videos on YouTube, working with the care team, we can 99% of the time get a good solution.